No one could have imagined what the next year would have in store. The nation experienced tragedy, sorrow and isolation, as well as unbelievable levels of bravery, determination and strength. The disease that tore us apart also brought us together as families, friends, neighbours and strangers faced an uncertain future. 2020. Will this year be remembered as one to forget?
"2020 is upon us. We have so much to look forward to. The Summer Olympics in Tokyo, Euro 2020, the final at Wembley. Together, folks, let's make 2020 the start of something special."
A mystery virus infects dozens of people in Wuhan, China. The victims succumb to a pneumonia-like illness. The disease would later be named COVID-19.
It is absolutely critical that public health authorities recognise a super-spreading event in the very earliest stages, before it goes absolutely explosive.
January 24th, 7 countries report COVID-19 infections, including the United States. There are 846 cases worldwide and 25 deaths. Today will be the first COBRA meeting to discuss the new strain of coronavirus. Boris Johnson doesn't go.
Are the Chinese sharing all the information we need?
We're going into COBRA now, and we'll be making a statement afterwards.
The WHO warned world leaders to stay on alert.
Make no mistake, this is, though, an emergency in China, but it has not yet become a global health emergency. It may yet become one.
The virus would have a chance to spread as families travelled for the Lunar New Year holiday and foreign nationals returned to their home countries.
Obviously, we're doing everything we can to ensure that people who do come to this country are properly screened and checked.
We got a leaflet as we landed. However, that was all in English, it wasn't in Chinese.
The growing number of cases in China was a worrying development.
While there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them.
Britons with families in China knew to take precautions. They would remember the SARS outbreak from nearly 20 years ago. That disease was more deadly, but COVID-19 was more easily transmitted.
I think the best we can do is just protect ourselves and trying to not get contact to everybody out there.
Not a lot of people are aware of the disease right now, so I think that's going to be an issue.
这3天一直都在下雨。
Chinese officials put Wuhan under lockdown.
That's the view from the apartment. Completely deserted down there.
Leaving British nationals living there uncertain about what would happen to them.
My family's so worried. My mum, she's texting me every 5 minutes, calling me every couple of hours.
I think I speak for the majority of the British expat community. This is a scary situation.
Although it would be great if we could be evacuated, I understand if we can't be. A quarantine's a quarantine.
The decision to lock down Wuhan was seen as draconian. The idea of this working in the UK was a non-starter for some. Little did they know what was to come.
You could not lock down London or lock down Sheffield or lock down... This country doesn't permit that.
Britons were repatriated from Wuhan, leaving one quarantine for another once back in the UK.
Morning. Day 1 of quarantine. We spent almost 40 hours on the road travelling from Wuhan to the Wirral.
The risk to the UK was seen as low until the number of cases increased significantly around the world.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
We're worried that if the Chinese authorities cannot get on top of this in the next few weeks, we may get to a situation where this begins to spread around the world in a quite major way.
breaking news related
Then,
to the
news the virus reached the UK.
It has been confirmed that there are 2 cases now in England.
2 members of the same family were the first to have tested positive for the disease in the UK. One of them, a student at the University of York. There would be cases in every nation of the United Kingdom in 5 weeks' time. Chinese scientists published the genetic code of the virus online in early January. This helped the UK to become one of the first countries to develop a test to identify COVID-19, and it also meant work on a vaccine could start straight away.
So there are a number of different groups racing to try and develop a vaccine, but what we need is someone to get there quick.
The government stressed that their actions would be dictated by the science. And the science was telling them, initially at least, that mass testing wasn't effective. This was counter to WHO advice.
We have a simple message for all countries: test, test, test.
So testing of people who do not have symptoms is not reliable, and so we won't be doing it.
Questions about the UK's testing strategy would dog Matt Hancock for the rest of the year.
OK, well, this is our cabin.
Some Britons found themselves in quarantine while on holiday as the virus spread around the world.
And this is it. This has been our home for 9 days. So we're all getting a bit fed up now.
The Diamond Princess cruise ship was sailing with more than 3,700 people on board when a case was detected. The passengers were quarantined, but not the staff.
The crew couldn't cope. You've got to remember, the poor crew, they're the same boat as us. And they're expected to walk round with a mask on, cabin to cabin to cabin to cabin to cabin. Yeah, that's your quarantine for you.
More than 700 people on board the ship contracted the disease.
We have felt relatively healthy throughout, apart from the day I was admitted to that first hospital. I didn't realise I was so unwell.
A British passenger would become the UK's first victim.
We're receiving reports from Japanese media that a British passenger who was aboard the Diamond Princess cruise ship has now died.
Boris Johnson chaired his first COBRA meeting. His main message was wash your hands with soap and water, whilst singing Happy Birthday twice. Or you could use hand sanitizer if you were lucky enough to find any. Supermarket shelves were emptied of not only sanitizer but loo rolls and dried and fresh food.
I'm a critical care nurse. I've just finished 48 hours of work. There's no fruit, there's no vegetables. You just need to stop it. Because it's people like me that are going to be looking after you when you're at your lowest, and just stop it.
Fears of a national lockdown led people to panic buy and shops to ration purchases.
The coronavirus does worry me a lot. I mean, it's a terrifying thing, but I cannot predict what's going to happen. What I can predict is how people act when they're panicked. So I started picking up a few extra tins here and there.
The general population started wondering what was going on.
Do I need to be wearing a mask or gloves or sanitising, or, you know, we should have this information available to us.
In the space of kind of a week or two, it's gone from something in China that doesn't really directly affect us to really affecting us, so it's kind of scary and sobering, really.
Chinese and South Asian people were being targeted. At least 267 hate crimes were recorded in the first 3 months of the year.
We were literally just sat at the traffic lights and he started just giving me all of this abuse, and he was threatening to come and basically just put me in hospital.
A student from UCL attacked on Oxford Street.
It's ridiculous. You know, it did not come from Chinese food. It came from, it's a zoonotic disease.
Coming up next, we will be live in Downing Street, inside that door, for the Prime Minister's news conference on the battle plan for COVID-19.
Boris Johnson announced the government's 4-part plan.
Containing the virus, delaying its spread, researching its origins and cure, and finally mitigating the impact should the virus become more widespread. Let me be absolutely clear that for the overwhelming majority of people who contract the virus, this will be a mild disease from which they will speedily and fully recover, as we've already seen.
I've done my backup, haven't I?
Yep, you have.
We were told the NHS was prepared for the job ahead, but some clinicians had questions on how it would work at a local level.
How they're going to make the decisions as to which patients to admit to intensive care and which patients won't get onto intensive care, how those difficult decisions are going to be made and who's going to be making them.
On March the 5th, reports emerged about the first death in the UK.
A patient with underlying health conditions has died after testing positive for coronavirus.
Some people grew more concerned about the pandemic, while others thought it was overhyped. Thousands attended the Cheltenham Festival, but the rugby and football seasons were suspended. The government's chief scientific advisor had told us herd immunity was the way forward, with 60% of us needing to get the disease. That's 40 million people.
So we want to suppress it, not get rid of it completely, which you can't do anyway, and also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
That was apparently the wrong answer.
No, we're very clear that herd immunity is not part of our plan, and it's a scientific concept. It is not a goal or a strategy.
Over the coming days, we would see how the government's strategy would play out. Life as we knew it was about to change. The challenge ahead was to protect our lives while protecting our future. We were 3 months into the year, with spring on the horizon, when everything changed. By Monday, March the 16th, over 6,000 people had died worldwide, 55 of them British. There was panic buying in the shops. Travel restrictions were in place and the streets were quiet. Then,
now is the time for everyone to stop non-essential contact with others. Stop all unnecessary travel. Start working from home where they possibly can. After schools shut their gates from Friday afternoon, they will remain closed for most pupils, for the vast majority of pupils, until further notice. We are collectively telling cafes, pubs, bars and restaurants to close tonight and not to open tomorrow.
it was pretty clear what was coming next.
From this evening, I must give the British people a very simple instruction. You must stay at home.
The measures were being put in place to lower the rate of infection and protect the National Health Service from being overwhelmed. But there were issues. Hospitals and care homes were running out of personal protective equipment, or PPE. Government-supplied face masks were out of date, but apparently fine to use.
I'm going to have to put a mask on.
And equipment recommended by the World Health Organization was different than what was being given to NHS staff.
This is something that is causing a lot of frustration among doctors, nurses, healthcare professionals in general. We don't feel we are getting the correct equipment.
As you know, we're being responded in for a potential coronavirus patient.
It would be the frontline workers in the health service that would be most at risk during the pandemic, and they would need protection.
We have turned round an incredibly difficult situation when demand for PPE shot up. We now have good PPE supplies to all sectors.
Mathematical modelling showed the UK was about a fortnight behind Italy, and cases there were spiking.
Maybe at the beginning we didn't know exactly what would be happen, but now we know what happened. You don't think that it's happening here and it can't happen everywhere else.
And it happened here.
So I have a 59-year-old gentleman with a...
NHS staff faced what may be some of the most challenging moments of their careers. They went to work when we were told to stay home and put themselves at risk to take care of the sick and dying, which included many of their own co-workers.
We're not used to treating other healthcare professionals, really, because we're in the working age and we're still fit and well. But I don't know. I struggled with these ones. I mean, there really isn't anything more soul-destroying than having to treat a colleague.
My father would not be afraid to point out what was wrong because he cared about the people. He cared about his co-workers, his colleagues, his family. He cared about people he had never even met.
He was loved by so many. It just makes me heartbroken to see him go, but it made me so happy that I got to know him.
He did not have energy left on that day. And that was first thing in the morning, and I thought, no, this is not right, because my instinct told me that this is not right, something not right. And I called the ambulance. And he just went out in his slippers. I didn't know he's never going to come back.
We said goodbye to him, not knowing that would be the last time we'd see him. And after that, from Sunday evening to Tuesday morning, he just deteriorated. Body shut down, organ failure.
Those in black and minority ethnic communities were most at risk of dying with the disease.
Black lives matter, and as do those of the poorest areas of our country, which have worse health outcomes, and we need to make sure that all of these considerations are taken into account and action is taken to level up the health outcomes of people across this country.
Some families lost more than one loved one to the disease.
And Mummy's going to be with Nanny, and he said, "What?" I said, "She's going with Nanny, mate." And he came over, gave me a hug. He had a little cry in the afternoon. He said, "Who's next, Daddy? Is it going to be you or is it going to be me?" I said, "I hope it's none of us." I said, "We don't want any more to be." He said, "No."
The situation was dire in care homes as infections ran rampant. The government delayed its pledge from the summer to regularly test staff and residents.
It's just so sad that we've not been able to give him a hug. We've not been able to say a proper goodbye to him. We sat there at home just wanting to be here, and it's sad that the first time that I am here is after he's gone.
Most of us who catch the virus will have minor symptoms, but for some, surviving COVID-19 means fighting for your every breath.
There's a misconception that coronavirus is a flu or a cold. It is not. I'm sure that this has almost killed me.
I'm telling you now, you need your lungs. And please, none of you take any chances. I mean it. Because if it gets really bad, then you're going to end up here.
At one point, 3,000 patients a day were being admitted to UK hospitals, and the virus was running through care homes up and down the country. The sacrifices being made by the NHS were recognised by the nation. The Prime Minister clapped with the nation to show his appreciation for the NHS. He would soon find out firsthand what an amazing job they do when he developed symptoms.
I've taken a test that has come out positive, so I am working from home, I'm self-isolating.
The Prime Minister was sent to the hospital when his condition deteriorated. He was there for a week and spent 3 nights receiving oxygen in intensive care. David Hunt woke up in the same unit as Boris Johnson.
Intensive care is not a fun place, to be. You see people die. It's absolutely horrible. I sell software for a living, right? I'm not a nurse or a doctor. and you see people just getting wheeled in. I just wanted to get out of that place.
Boris Johnson went to Chequers to recover for a fortnight before getting back to work. But the majority of us wouldn't be going back into the office for some time. The country was asked to stay at home, and that meant shops wouldn't be opening, employees wouldn't be working, and customers wouldn't be buying. We already said goodbye to our social life, and now it could be goodbye to our jobs too.
We are seeing an absolute cliff edge here in terms of the impacts on the airline sector, and we need to do everything we possibly can to protect this sector and protect airlines.
The restaurateurs that I've been speaking to over the past 24 hours have suddenly gone, we need to start planning our worst case scenario, which for most of them is going, how long can we keep our restaurant shut for, and how long can we keep paying bills while our restaurants are shut?
Chancellor Rishi Sunak's plan to stave off economic disaster meant he had to break all the rules.
Today I can announce that for the first time in our history, the government is going to step in and help to pay people's wages. Government grants will cover 80% of the salary of retained workers, up to a total of £2,500 a month.
We were all going to get through this, and it's great to hear what the government are saying, that they're going to support us, which has actually taken a load off my shoulders, because I thought I could lose everything. 28 years of being in business.
Retail, hospitality and aviation have become the biggest losers during the pandemic.
If we don't have people in the restaurant, there's not an income, there's no money to pay the staff. Or for them, if they don't earn an income, they cannot go shopping for food. They cannot pay their rent, they might be out of their houses.
We've just lost our major source of income. We will, one way or the other, reduce the amount of income for artists, for freelance, our front of house team, our bar team, our technical team, never mind the artists on stage and backstage. And essentially jeopardise the future of the organisation.
Additional measures were announced by the Chancellor in an effort to shore up the economy, but thousands of jobs have already been lost. 12,000 jobs at British Airways, and 3,500 positions at Virgin Atlantic. Travel bans and closed borders helped bring an end to Flybe, which was already in trouble before the lockdown.
A lot of us have done this job straight out of college from like 18, 19, so we're not really sure we're going to do that. Sorry.
The lack of footfall around city centres has also led to difficult times for retail shops. Debenhams is going out of business, putting 12,000 jobs at risk. 13,000 jobs may go at Arcadia, the owner of Topshop. Unemployment is expected to rise to 2.6 million by the middle of next year. Applying for jobs in this climate hasn't been easy.
It's more depressing when you apply for a role and you obviously apply online now, and then you hear nothing. That's more depressing than being told, sorry, you haven't got the right skill set.
One employer was inundated with applications for 10 jobs.
I expected a few hundred, not 15,000. So it's gratifying and worrying at the same time. I would love to employ them all.
Employers had to change their way of working.
So we started to encourage people who could work from home to do that and equip them to do that. And we did that right at the beginning of March.
There were plenty of people happy to give up the morning commute for meetings online.
I've got a better work-life balance. I'm not having to wait for delayed or cancelled Northern Rail trains, and I know that as soon as I get out of bed I can log onto my laptop and not be late for work, so I've quite enjoyed working from home.
I think there's a real sort of mixed chat about people wanting to come back in, people wanting to work from home. I think there's a big market for coming into the office and for people coming to the office, because I think people want to socialise.
Get the music on. Technology allowed us to maintain some semblance of a social life. Even through the lockdown, people were finding creative ways to make connections and keep in touch with their communities. But for some, battling loneliness would be the biggest challenge.
like everything's just gone mad and it kind of feels like a zombie apocalypse. Like there's barely anyone in the street and stuff like that. It's hard to like comprehend. I had 5 years of school just leading up to one thing. So for it not to happen, and I had like plans and stuff like that even for results day, and it just like can't happen anymore.
Every day, like, you're just improvising, you don't really know what you're doing. A few weeks ago, I was there, had my books out, I had a countdown on my phone saying 73 days left to your exam start. And now I'm just playing FIFA at my house, just not really doing much.
Millions of students were forced out of the classroom during the spring lockdown. The exams they spent years studying for cancelled.
It was weird because like normally when you sit an exam you'll know if you've done like okay or if you've done bad, but because you didn't know, like you don't know what it could have been like.
I think it's the idea that we didn't really know like how your results would be because you didn't sit the exam, so I didn't know. I was like, but like I'm happy with the results, so it's been okay, I think.
I lost my place at medical school.
Instead of exams, A-level students were given grades based on an algorithm. In some cases, the results varied greatly from their predicted grades.
We thought, oh, maybe they will do them in a different way, maybe they'll move them a little back or something around that, but for them to just say, oh no, exams are cancelled, it's just kind of like a slap on the face, really.
Around 280,000 students had their results downgraded.
I got an ABB, I was predicting an A-star AA. I'm trying to get into medicine, so sadly with the grades that I've received, I can't go anywhere.
It's important to admit that mistake and then move on and try and make a better appeals process and possibly just take us back to our centre assessed grades. You know, our teachers have known us for years. They know what we're capable of.
Boris Johnson had called the system robust and dependable, but the government eventually made a U-turn.
The idea that this problem has somehow come up and bitten you in the backside is nonsense.
Education Secretary Gavin Williamson was accused of acting too late.
But at every stage, both DFE and Ofqual, in terms of the development of a moderated grade system, have actually put the issue of making sure that children from the most disadvantaged backgrounds are at the heart of what it does.
Life wasn't that simple for the younger students either, as parents took over the reins as teachers. It was a problem faced the world over.
מה נראה לכם? המורה למוזיקה של הבן הקטן שלי, היא שלחה תווים הבוקר. מה אני אעשה עם המידע הזה? מה, יש לי הרכב של איזו להקה? אני לא יודעת לקרוא תווים. שנייה, אני מוציאה קלרינט ויושבת עם הבן שלי לעזור לו עם התווים. די, חבר'ה, מורים, תנמיכו ציפיות, זה לא הגיוני.
So can we put one on the bottom? I'm quite sad that my friends can't really be with me because of the coronavirus, but it's nice seeing how my mum and dad teach me, and I can teach my brother some things.
I think there's going to be challenges where we have to all cut ourselves some slack and just do the very best that we can. I know that there's going to be beautiful moments and really challenging moments, and that's okay.
We all tried to make the best of it with tablets, laptops, desktop computers and smartphones.
How are you doing? I'm good.
The kids were literally left to their own devices.
The good thing is that I'll still have an education, but it's just going to be at home. And most of my clubs now have been made, so it's going to be online. Like my piano class is going to be FaceTime, and a club called Little Voice is going to be on Google Classroom.
Though not every family has access to digital devices.
With one laptop, how do you manage it during the day? How do you juggle it between all the children?
We normally start with the youngest, try and do her first, and then go all the way up and just squeeze it all in through the day, but also we can't get it all done in one go because we have to share the laptop, so it can take quite a while.
Maths and English weren't the only subjects on the timetable, there was music. From Mylene Class.
All over the country, I went to Scotland, Wales.
And PE with Joe Wicks.
So every single day next week, from Monday to Friday at 9 a.m, I'm going to be the nation's PE teacher.
The 2020 student experience was anything but normal.
This is my bed, where I've been spending most of my time now.
University students returned to campus for online lectures and some socially distanced fun. But the numbers of COVID-positive cases amongst students grew.
Because obviously all of us got symptoms as well and we all tested positive, it was quite reassuring to have everyone else with you as well. So we weren't alone, we weren't having to be stuck in our own rooms.
It's horrible because you can't even really you can't go outside at all.
and I've obviously had to tell my flatmates to isolate, which was after only knowing them for like a week. It wasn't like the greatest conversation.
Young people felt they were being blamed for starting a second wave of the virus. Social distancing, self-isolation and a reduction of face-to-face lectures was having an impact.
We've seen lots of students saying that they're spending all or most of their time within their university accommodation, and clearly that kind of risks feelings of isolation or loneliness, and that combined with worsened mental health is definitely going to be a challenge.
Throughout the pandemic, there have been fears for the nation's mental health. Many of us have struggled with loneliness, depression and general anxiety because of COVID.
I'm a little disappointed with some people, some friends that I've not heard from anywhere near as much as I expected to. The feeling I have now, or have had moreover in the last 6 months, is just of being very numb to everything, feeling like I can't get a reaction out of myself for anything.
Most of us feel that somehow if we're lonely it's our fault, and we are a bit ashamed of it and don't want to talk about it. But I think we can all think about, is there somebody today who might be lonely, who you could ring up and just tell them that you were thinking about them.
Communities did manage to come together during lockdown, to have a little dance in the street, a socially distanced marathon, or a charity walk around the garden.
It was like jolly to the castle when ordinary people were obeying the rules and staying home was becoming.
Living under lockdown was not an easy thing to do.
Out the way.
So some people were a little upset when news emerged that Boris Johnson's closest advisor had driven with his wife and young son from London to Durham and took his family to Barnard Castle. His wife had COVID symptoms when they made the journey. Mr. Cummings developed symptoms later on.
I knew what the guidance was. It talks about exceptional circumstances with small children, and I think that in all the circumstances I behaved reasonably and legally, as I said.
My opinion is that if I had a 4-year-old son in the situation he was in, I wouldn't have hesitated to do exactly the same thing.
Sorry, I'm speechless with him. He's disgusting. He should step down before he's asked to leave.
A lot of people have done the same thing. It's not like it's an uncommon thing, but obviously him being a figure that he is, so I think that it's up to the government. But it would be nice for him to resign.
I think he's taking the public for a fool.
Dominic Cummings did leave Downing Street, but much later and over a different crisis. After nearly 2 months under lockdown, Boris Johnson announced there was a plan underway to ease some of the restrictions. There would be a gradual reopening of society if certain conditions were met, which would decrease the number of deaths and minimise risk to the NHS.
We have a route and we have a plan. And everyone in government has the all-consuming pressure and challenge to save lives, restore livelihoods and gradually restore the freedoms that we need.
The Prime Minister replaced stay at home with stay alert and encouraged people back to work if they couldn't work from home. Wales, Scotland and Northern Ireland were not going to follow England's lead.
For Scotland right now, given the fragility of the progress we've made, given the critical point that we are at, then it would be catastrophic for me to drop the stay-at-home message, which is why I am not prepared to do it. And I'm particularly not prepared to do it in favour of a message that is vague and imprecise.
The message I will be giving to people in Wales is while they must be alert to the continuing danger of coronavirus, if you're not out of your house for an essential purpose, and that does include exercise, and it can include shopping, and it must include going to work for people who can safely do so, staying at home remains the best way that you can protect yourself and others.
Lockdown restrictions for England were eased on the 13th of May, with people getting their first taste of freedom for weeks. Over time, we saw a further lifting of the restrictions. shops began to open. There was unlimited exercise.
2 more steps to go, said Hugh.
And some primary school students went back into the classroom. But we needed to keep an eye on the numbers.
We are, I would say, through the current peak. We need to be worried as a nation that as we come through this current peak, we do not seed another one.
The lockdown seemed like a distant memory by the time summer came around. Families planned quarantine-free holidays and people were eating out to help out. It was a battle to save the health of the economy. Gradually, restrictions were eased and summer holidays were back on. Spain opened its borders to Britons in June. Tourists could stay without having to quarantine upon arrival.
As long as we all take our own protection and take responsibility for ourselves and everybody else, we should be all right.
It was a blessing for those who were left disappointed from cancelled trips earlier in the year.
We thought we weren't getting married in New York, we were just going to do something in the UK. And now we'll be able to go back. It's absolutely fantastic.
We do have flights booked, hotels booked, everything. We'd obviously postponed them once already, so it's been quite a stressful time for us.
It was a far cry from the thousands of passengers who normally head out for some Spanish sun.
The customer confidence is down. Do people want to be on an aeroplane at this present moment in time, going through the securities in airports, etc., etc. So I can understand why people are a little bit apprehensive.
Air bridges were set up to help the travel industry recover and allow UK residents a well-earned break after lockdown without having to quarantine after they returned.
So now I'm so excited to go now. Yeah, it's like a freedom.
I was thinking that there was a good chance I'd have to self-isolate when I came back. I work from home, so it's not the end of the world, but it would have been a bit of a drag.
Going back home to see my family with my baby. I haven't been there since December, and after this lockdown, I'm really looking forward to seeing them.
Holidaymakers were seduced by the sun and sand, but some regions of Spain were seeing a growing number of cases. The government decided to close the Spanish travel corridor and ask anyone returning from the country to quarantine for 14 days.
We've got a small hotel here, 5 rooms, and that proportionally speaking, lots of them are cancelling. So that's because people might not immediately think to cancel a restaurant reservation because it's part of other things they book for the holiday. They'll deal with their flights first, their hotel. The hotel rooms are dropping like flies.
5 days ago it would have been fine, 5 days later it's not.
But 1 day later even.
And yeah, 1 day you can and 1 day you can't.
I'm afraid you are starting to see in some places the signs of a second wave of the pandemic. When people are coming back from abroad, if they're coming back from a place where I'm afraid there is another outbreak, they must go into quarantine. And that's why we've taken the action that we have, and we will continue throughout the summer to take such action where it is necessary.
A rise in the number of infections meant it soon became necessary for France.
We crossed over yesterday, literally 24 hours ago, drove quickly down south, and then last night we realised that the quarantine had come in. So we quickly went online, booked a spot on the Eurotunnel and drove back.
It should be a full quarantine or no quarantine. It seems to be the changing isn't helping the economy, it's not helping people's travel plans. So it's just confusing everyone, to be honest with you. I think everyone just wants clarity.
British tourists rushed to the border to make it back before the deadline.
When people travel at the moment, when coronavirus is still a thing, just need to be aware that unfortunately things can change very quickly. And, you know, if you go with your eyes open, you know that things can change. It won't then come as so much of a surprise.
A staycation was an option for those not wanting to risk a quarantine.
Well, we've been looking at cottages, just places where we can have a little staycation, and I think because we've left it quite late and everyone is doing the same thing, it's proving really hard to find a place where all 5 of us can go.
UK beaches were full on sunny days and campsites were even busy on the rainy ones.
We have some great fun, the kids love it, kids are happy. As long as kids are happy, we're happy.
The summer season brought a much-needed boost to the UK economy. The Chancellor's Eat Out to Help Out scheme in August helped sell more than 100 million meals, according to the Treasury.
Been busy our weekend and also Monday to Wednesday. Wednesday just gone was our the most reservations we ever had in one day since we opened 7 years ago.
The government's scientific advisors, though, were concerned there was too much socialising and not enough social distancing.
People have relaxed too much, and now is the time for us to re-engage and realise that this is a continuing threat to us.
By autumn, there was a divergence among the four nations on how to control the virus. Communities on either side of a national border faced different restrictions and local lockdowns. There were disagreements about messaging and measures, but all agreed a vaccine was urgently needed.
Each single project does not have a high probability of success. So although everyone goes out with great enthusiasm and we hope they work, it's never the case that you know you've got a vaccine that's going to work. This is going to come from somewhere. We just need to back lots of horses at the moment and to make sure we're in a great position to access a vaccine when it occurs.
A breakthrough came in November when interim results were announced for one of the vaccine candidates.
The Pfizer-BioNTech vaccine has been tested on over 40,000 volunteers, and interim results suggest it is proving 90% effective at protecting people against the virus.
It's not about a single winner and everybody else is losers. We need as many vaccine candidates as possible for a number of reasons. First of all, we have interim data from the Pfizer vaccine. We don't know how long it will give an immune response. So the more candidates we have, the better the toolbox is, and the more vaccines in general we have that can be rolled out, whether it's to the UK population or globally. So we need as many candidates to actually get past the finishing line.
In early December, the UK became the first country in the world to approve the Pfizer-BioNTech vaccine for use, nearly a year since the virus entered our lives.
This recommendation has only been given following the most rigorous scientific assessment of every piece of data, so that it meets the required strict standards of safety, of effectiveness, and of quality.
The UK pre-ordered 40 million single doses, and once you allow for wastage, that's enough to vaccinate around 18 million people. 90-year-old Margaret Keenan made history as the first person in the world to receive the jab.
Now I've done it, and hopefully it'll help other people to come along and do as I did, you know, try and do the best to get rid of this terrible thing.
The national rollout had begun.
I felt proud and emotional. We've worked very hard to get to this point, and the health service in general has struggled throughout the fight for COVID-19, so it feels like a momentous day.
I don't know, it's just been nerve-wracking today. I really lost for words this morning. Yeah, I didn't think it'd be possible this year.
It's the first time a major vaccine has come through so quickly. So to be part of that is amazing.
Some critics are concerned that the years of research and development usually needed to produce a vaccine has been condensed to just a few months.
And I just implore people to think really hard and just to do it for all the right reasons. There are going to be doubters, but I think we should do it. We should do it.
The vaccine won't be a silver bullet.
I think we don't know yet exactly how good that all the vaccines are going to be at preventing the transmission of the virus. We know they're good at stopping people getting symptomatic disease, and we know they're good at protecting people from severe disease. We need to understand how good they are also at stopping transmission between people, and that information will come over the next few months.
It will gradually make a huge, huge difference. But I stress gradually because, you know, we're not there yet. We haven't defeated this virus yet.
Scientists became concerned about a mutant strain of the coronavirus.
we have identified a new variant of coronavirus which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants.
Viruses mutate all the time, but according to the government's scientific advisors, this variant was more transmissible. But there was nothing to suggest it was more deadly. Boris Johnson took action with new restrictions for London and the southeast of England.
Residents in those areas must stay at home. Non-essential retail, indoor gyms and leisure facilities and personal care services must close. People must work from home if they can. In England, those living in Tier 4 areas should not mix with anyone outside their own household at Christmas. Across the rest of the country, the Christmas rules allowing up to 3 households to meet will now be limited to Christmas Day only, rather than the 5 days as previously set out.
News about the variant prompted several European countries to close their borders to the UK. Hundreds of trucks were backed up on the motorway waiting to enter France, and UK travellers were banned from at least 40 countries. It was like déjà vu: travel restrictions, closed shops and government requests to stay at home.
It doesn't really feel like Christmas, it feels really miserable. I think if it weren't for the kids, we probably wouldn't have even put the tree up.
It's a bit hard, but you just have to try and crack on with it. It is hard, really hard, but what can you do?
Worrying isn't going to change it, is it? So I just move forward instead of in the same place.
I don't want to live in this kind of world with people passing away and everything. It's just heartbreaking.
Coronavirus changed everything for us in 2020. From the way we live and work to the way we socialise with friends and educate our children. We relied on experts in science and medicine, and we were asked to accept rules that limited our freedom. The old stresses of day-to-day life were replaced by new worries about the future. 2020, we lived through nearly a year of COVID-19, but we may be feeling its impact for several years to come.